Hey, y'all. Welcome to another episode of the Risk Matrix with myself, Dr. Logan Martin, and Mr. James Junkin. Hey, James.
Hey, roll tide. Roll tide. Got some exciting news coming up here, ripped from the headlines. How y'all doing?
I hope well. We're here again, rolling out things, all risk and safety, supported by Veriforce. Thank you, Veriforce, for letting us get this information out there and letting us talk about things that are near and dear to our house. So I'll start it off, James. We got a rip from the headlines. CPWR put out an article or something on their website that says drug overdose and suicide deaths are down based on some of their research. I think this is a great thing.
Absolutely. Came out in, I guess, February's issue of the National Safety Council's Safety and Health publication had an article that drug overdose deaths and suicide in construction are down. They're decreasing. After many years of it increasing, after the horror stories that have been told, lives devastated, lives lost, we're finally seeing some movement uh, in in these statistics.
In the
So
statistics.
here's the statistics. So CPWR data researchers said that construction workers aged 16 to 64, they found that drug-related overdose deaths fell 28.8% from 2023 to 2024, while suicides went down 1.7%. So I think that's outstanding. Now, if you talk to the North American Building Trades Unions and the folks over at CPWR, they're saying that they attribute this decrease to the education program on the risk of opioids and opioids in general, the fact that fewer opioid prescriptions are being written. If you've been to the doctor lately or had any surgery, it's not like it used to be, thank God. And also the widespread availability of naloxone. Isn't that how you say it?
Naloxone.
Naloxone?
Naloxone.
Yep, naloxone. I know a lot of companies are using this in their first aid kits and training their workers to administer it on site. And then, hey, decrease stigma on substance abuse and mental health issues.
Right.
People are coming forward now. They're using their employee assistance programs. They're getting the treatment and support they need. So hats off to the folks in the construction industry. You're bringing more workers home safe from opioid deaths and suicide deaths this year than you did in previous years. So job well
Yeah.
done.
And
Let's figure.
I'm gonna give a shout out to National Safety Council because they've been working hard on this for some time now. I know that they've been working on the opioid issue and the mental health issue, and there are a lot of besides CPWR, there are a lot of construction industry organizations that do a lot to bring that education both to the workers, the workforce, but also to the safety profession, right? And we talk a lot about it on this show. We've had several editions of our show where we've talked about mental health issues, about apps that are out there to help people kind of see the issues as they come down the pipe. Actually survey workers on what's going on, right? So, hats off to them too, because I think we have not only a greater emphasis on it, but people are really kind of digging in and bringing these things to their workforces. So, thank you to the safety professionals that are doing that, and the organizations in the building industry that are also helping. So what are we going to talk about today, James?
Hey, let's talk about. I want you to listen to the words subcontractor management, which is different than contractor management, although some
Okay.
of the same
I'm gonna
principles
need you
apply.
I'm gonna need you to run it down because I think people get confused. When I think of a subcontractor, right, if I'm LF Martin LLC, right, and I hire somebody to work for me, um, that's it, right? That's my subcontractor. Or is it more than that?
Well, it depends. To quote your famous
Just
line,
depends.
right?
Yep.
So typically when we see let's set construction aside just for a moment and deal with the way we see things in the oil and gas industry and general industry. you'll have a hiring client that hires a contractor. The hiring client has pre-qualification requirements for that contractor, right? The contractor meets those pre-qualification requirements, and that's contractor management per se, the beginnings of contractor management.
And we all go to
Uh,
work then, right?
we all go sometimes, sometimes. Uh, then if that contractor hires someone else to do the work on their behalf, that's a subcontractor. Now, in the construction industry, a lot of times the terminology, you correct me if I'm wrong, is this relationship between the general contractor and the folks the general contractor hires to perform their tasks. Sometimes they're referred to as subcontractors, but even then, you have subs of subcontractors.
That's
Why is
correct.
this? Why is this an issue? Because many times what we're finding is the further down the chain of responsibility you go, the less robust the safety management systems are, but the risk is greater.
Mhm. And
Okay.
nobody's checking.
And nobody's checking. In a recent audit, assessment audit, whatever you want to call it, this past year, we kept finding subcontractors. Many times the hiring client had no idea that these subcontractors are on their job site, they're performing tasks. They had no insight and visibility into the training and qualifications of these workers until someone got seriously injured or killed, and we found out who they were at the deposition, or when we got something in the mail, or when OSHA said, we want to invite you down here to have this multi employer discussion. So, subcontractor management has really been highlighted by the failures, and they represent a serious safety risk, financial risk, reputational risk to everyone above them in the chain of responsibility. So that's what I want to talk to you a little bit about tonight with you, Dr. Martin, and have a conversation on what the risks are from poor subcontractor management, but what companies can do, especially contractor can do to protect themselves when they hire subs.
So let me just insert here something that I've seen. Right, I've seen in a contract case that they'll allow the hiring of subcontractors. They'll require a management system like ISNet World or Veriforce, right, or Avetta, and they have them put their information in, and then they require that they do the same for their subcontractors, and it never gets done. Right,
Never gets done.
it
Never
never
gets
gets
done.
done.
That's one of the products Veriforce is launched to be able to see from the hiring class perspective to see down through the supply chain to the subcontractors for verification of things like insurance. Why is that important? I had a case in North Dakota many years ago where an oil company hired a contractor to come do tank cleaning. The contractor wanting to throw a bone to one of his friends who was just getting started, a one-man company, subbed out some of the work to him. The oil company had no idea this contractor was out, this subcontractor was out there, or that this contractor was going to do any subbing, right? So this one-man show picks up a day worker, and that day worker ends up being severely burned, transported to the hospital in another state, luckily lives. He's disfigured. Come to find out, the subcontractor does not have workers' compensation at all. So, what's the recourse for this worker? The only place this worker can turn, because it's not his fault that he wasn't properly trained. It's not his fault he didn't have the adequate PPE. It's not his fault that the contractor doesn't have workers' compensation, but he's the one bearing the wounds of it, and his family's the one that's sitting home with no income while their loved ones in the hospital fighting for their lives. Okay? The only recourse they have is a courtroom.
Well, and
So
and this is
now,
one of the rare cases where I would say things don't roll downhill, they roll uphill. And they roll right up to whoever's managing that sub of a sub of a sub, and sometimes to the owner, right? These are the things that Veriforce, preaches to us about quite a bit. Is like, managing the supply chain is just not a one and done. It's an actual, are you looking down into the supply chain deep enough to manage the risks that come along with somebody hiring somebody else that you don't know about?
So this is you said a mouthful there, and one of the key takeaways I think is liability can shift upstream. Many times we see the MSA between the hiring client and the contractor, we're shifting liability downstream. Then we're going to shift from the contractor to the subcontractor downstream. Hey, that may be what the paperwork says, but it does not always work that way in reality if you have not exercised reasonable care to ensure a safe workplace. Part of the reasonable care is what was your pre-qualification in trying to determine the qualifications and worthiness and frankly quality of the safety program of this subcontractor you're hiring. So OSHA's multi-employer citation policy is about as clear as mud in all actuality, right? We know the different levels and of responsibility when it comes to controlling contractors, creating contractors, exposing. I'm saying contractors, but companies that are in there. Uh, if a subcontractor creates a hazard and oversight is lacking, understand citations may follow. We're litigating a case on this very issue right now in Texas, right? So what's the point? You need to ensure if I'm a hiring client, I want to make certain, number one, that I am notified of any subcontractors that are performing work on my job site, period. I need to know who these folks are. There needs to be a mechanism where the subs are held to the same standards as the contractors. And that's really, I think, what Veriforce is doing right now is providing visibility through the supply chain down to the sub so that the requirements that are on the hiring client are on the contractor are also on the subcontract,
So let,
right?
let me give you an example of something that I've seen that kind of goes along with this. It's not just the insurance, right? And it's not just, are they vetted properly, for policies and procedures and things of that nature? It's also, are they vetted to do what they say they're going to do or what they've been asked to do? And I mean, I recently had somebody out on a site that was performing confined space rescue. And it was kind of one of those things. I mean, I'm a consultant, right? Somebody calls me on the phone, they say, "Can you?" And I say, "Of course I can." Right? And then I hang up the phone sometimes and I go, "How am I going to do that?" Right? Maybe not quite that out there, but it happens. People who are looking for work, especially in an economy that, they want to expand their services, they may not be completely qualified for what they do, but they say, well, we can do that, right? But are they qualified to do it? Do they have the training to do it? Right? These are all things that come in that subcontractor qualification um, package, so to speak, right? These are the things that you have to look at because you don't want somebody saying, I can do confined space rescue. I'm just going to go buy a winch and I'm going to, buy a monitor and I'm going to wing it. That's not the person that I want hauling me out of the hole. And so, not only is it the things that you mentioned, but it is actually, are they qualified? Are they vetted to do what they say they're qualified to do?
And we find this all the time in the assessments what you do for Veriforce and for other hiring clients and other large contractors that many times when we get to the subcontractor level, the only training we're finding, if we're finding any training at all, is fundamentals training, orientation level training, OSHA 10, OSHA 30, which does not fill the competency gaps to perform tasks like lockout, tagout, operate powered industrial trucks, rigging. The list goes on and on and on and on. And there's case study after case study after case study. If you want to go back to BP 2005, Texas City, what do we got? We got some subcontractors also involved in that incident. 2007, the Seattle tunnel collapse that happened out there that injured several workers. What did the investigation reveal? Inadequate supervision of subcontractors. The incident investigation said the general contractor failed to coordinate safety protocols across subcontractor teams. As a result, hazards went unaddressed, and then you had the collapse. You had the New York crane collapse in 2008. Again, inspections were incomplete. The general contractor was criticized for failing to oversee subcontractor activities. So we could go through all these different case studies. If I'm a hiring client, the first thing I need to be thinking about is how do I get visibility and assurance that whether it's construction related and I've hired a general contractor and they're hiring subs, or I'm over here in some of these other industries, I'm hiring a contractor and they're hiring subs. How do I get visibility that these contractors, subcontractors are qualified to do their job and do it safely before we wake up one day and have an incident and then it's very obvious. It's
Hmm.
very obvious. Mhm. So,
Agreed.
uh, one of the things, people, and we've written extensively about this is, well, we're going to paper over it. I have indemnification and hold harmless language in my contract. So I'm pushing that down to the contractor. Listen to me if you're a contractor that hires subcontractor, okay? You have indemnified and said that no matter what happens, the subcontractor's fault, your fault. You're holding harmless the hiring client and you're indemnifying them against any claims. Here's the issue. Did you talk to your insurance company about that? Because you may not have coverage for claims, third party claims of subcontractors. So a subcontractor employee gets injured out on the job site. Workers' comp's an exclusive remedy, but they file suit for either wrongful death or gross negligence. They sue the contractor and the hiring client. The hiring client comes and says, are you going to honor your indemnification and hold harmless? Absolutely, I am. Put your insurance company on notice. The insurance company says, wait a second, you're not covered for this third party claim from this sub. We weren't involved in it. So these are things you need to think about when you're talking about subcontractor management. It's important for the hiring client, but to me, it's more important to the contractor that's hiring subs. So I get this all the time, and it's almost to the point where I just get super frustrated. But my hiring client didn't tell me I had to do this. My hiring client didn't tell me I had to pre-qual my sub. The hiring client didn't tell me I had to verify their training. The hiring client didn't tell. Look, man,
Well,
this is your company. You're responsible for these folks. You're going to be held accountable by OSHA and a multi-employer citation policy and by that hiring client if that subcontractor employees do something that results in serious physical injury or harm to the assets of the hiring client or environmental damage. You're the one
y-
responsible.
it's your responsibility as an owner or CEO to protect yourself, right?
Yeah.
And it's more than just paper language, right? If I'm gonna come along and punch you in the face, James, do I need to tell you to put your hands up,
No, no.
right?
But the thing I want contractor CEOs, and we have several that listen to our podcast, not just safety folks listen to our podcast, Dr. Martin. These are contractor CEOs. Uh, Neglecting subcontractor management threatens the business stability. It threatens you as going on as an ongoing concern. Okay. So I just encourage contractors, particularly large contractors that are hiring subs, you need to get a handle on this from a legal standpoint, from a reputational standpoint, from a quality standpoint, from a safety standpoint, to know that you're protected, that you've got a reason, you're exercising reasonable care in your selection of these subcontractors, and you're performing the proper inspections and doing due diligence to see do they do what they say they're going to do.
Yep. And the
So
last
it's
thing they
not.
want to do is see James Junkin coming along with one of his deep dive assessments and showing them exactly what they're not doing, right?
Right. Or to find out at the deposition that the folks we got doing lockout tagout have 2 minutes and 56 seconds of online e-learning lockout tagout awareness training, and they're locking out and tagging out and then hydrous ammonia line somewhere. What's your due diligence, right? What's your due diligence?
So how does
So,
somebody get started with that, James?
well, the first thing I think you need to do is you begin contractually. Now, Bear Force has a good team over on the procurement side of the house that can assist you in looking at your MSAs, what they say from your hiring client, if you're a hiring client, to make sure that you got the right coverages and things of that nature. If you're a contractor, I think they probably provide some of those same services. But if not, you need good legal counsel to make sure that your contract between you and the sub is solid. Then you need to put in a good pre-qualification process, right? Pre-qualification is not the end of it all. It's just, hey, this is what we need you to do to be eligible to go on a job site.
And you know
And then
what?
you need,
I think a lot of people make a big mistake there. They go with pre-qualification. They say, "Well, we're done, right? We
yeah, we're done.
pre-qualified. They gave us everything we need." But projects are ongoing. Projects aren't pre-projects. They are active projects, right? So the qualification progress always has to be ongoing throughout the project. Things change. Training expires.
Absolutely.
Insurance
Well,
expires. It's insurance changes.
yeah.
Personnel
I mean,
changes.
so kind of following up with that, it's a continued journey. Your responsibility doesn't end with pre-qualification. If you're exercising reasonable care, that means if I'm a contractor, I'm going out and I'm checking on my subs. I have a process to determine, are they doing their work in a manner that's quality and safe? Is it meeting our clients' expectations from a quality and production standpoint? And is it safe? Too many times we're finding out that there's a lot of checkbook, if you will, uh, relationships where my oversight only exists in a financial relationship, meaning I got the contract, I subbed it out, and I'm just a billing entity,
Yep.
right?
Yep.
So that represents significant threats. So pre-qualification, yes, but then we need to know, do you do what you say you do?
And do you continue to do what you say you do?
And so there are a lot of different ways that you can go about doing that, but being involved, having a process, following the process is very important, not only to hiring clients, but particularly contractors, because contractors are the ones that are bearing additional risk. You're bearing additional risk.
Yeah. So if you don't know where to start, we're graciously supported by Veriforce. They do have a process for this. They have a lot of great people over there. Ring them up, pick their brains, see what they say. They can tell you where to look, and how to look, and maybe give you some ideas of how to get the process started, if not a complete process altogether. So, James, that's another wrap. We got some episodes coming up soon on conferences. I know that's one of your favorite things to talk about. We'll be talking about conferences, tips for how to get the most out of conferences. James will be speaking at quite a few of those coming up. We'll also be talking about Workers' Memorial Month, which is in April. Maybe we'll have an episode on that, but we got a lot of good things coming up on the show. We thank you so much for your support. We'd love to have you on. If you got something to say or something you want us to talk about, let us know. Drop it in the comments, send us an email, reach out to us on LinkedIn. We're both available most days on LinkedIn. And what else you got for us to take us home, James?
Hey, also say this, both you and I have newsletters on LinkedIn. You're publishing a lot more than I am, but subscribe to those newsletters. You can get insights into what our thinking is involved around occupational safety and health in your inbox, sometimes daily, but at least twice a week from both of us. There's also for Veriforce, we have a blog over there. A lot of articles are being posted on Veriforce's website from both me, Dr. Martin, the expert services team at Veriforce, members of the strategic advisory board, upcoming webinars, lot of opportunities to continue to gain in professional development found over there on Veriforce's website. But I want to thank everyone again for listening and supporting our podcast. Hey, you want to help us out? Hit that like button, hit that subscribe button. Go over there, pow, pow, pow. Share it with your friend. Your mama wants you to share the risk matrix. I guarantee you she does. My mama listens to the risk matrix and get in trouble all the time. So roll tide, baby, roll tide. But anyway,
Okay.
thank you for supporting the podcast. We do this for you. Till next time, y'all keep bringing those workers home safe from high hazard jobs. Roll tide,
Roll
baby. We're
Tide.
out.